Hi, I'm Dr. Matthew Martin at the Hand and Plastic Surgery Center in Grand Rapids, Michigan. I want to take just a minute to talk about what's probably the number one diagnosis that we see and treat here in our office, and that's trigger finger. So you may already be familiar with trigger finger. A lot of people are. Trigger finger really is a condition in which some of the fingers either are painful when you flex them and extend them, or in some cases, the fingers just simply don't straighten out all the way without some snapping or catching. Some people get locking of the fingers. For some people, it's not that advanced and they may just get some clicking that they experience either here or here in the knuckle. But invariably, the reason for trigger fingers is that there is a very tight tube system that goes up the finger underneath the skin and between the bone and the skin itself. That tube system consists of 5 pulleys called the A1, A2, A3, A4, and A5 pulley, and some others that are along the way too. But the flexor tendons, which help us to flex and bend our fingers, are the structures that go through this pulley system that we've been discussing. And in trigger finger phenomenon, really what it is that this first part, or the entry to that tube, or that tunnel through which the flexor tendons have to travel, gets too tight. That can either be because there's some additional thickness to the tube itself here, or sometimes, in some cases, the tendon has a bit of a bump to it. So what happens is that as you go to bend your fingers down, the tendon retracts back up towards the forearm more. And then when you go to extend the finger, if there's too much tightness at that A1 pulley, the finger won't extend, or at least it won't extend without some clicking and pain. So some patients are able to finally snap it open, or for some patients, they have to take the other finger and kind of crank on it and get it open that way. So when a patient comes to us with a referral for a trigger finger, usually that's a diagnosis made by the primary care doctor, or sometimes a patient comes with sort of a preconceived notion about that based on some online learning they've done. Things we can do would be to first try a steroid injection. Steroid injection would be delivered right here to the A1 pulley that we're talking about, and that's done through a needle just here in the office. The steroid injection can be helpful for a certain population of patients. Usually we see that it's more helpful for folks that have not had this going on very long. Also, in my experience, it's more helpful for patients who are non-diabetic as opposed to patients who are diabetic. And if a steroid injection is going to work, for a lot of patients, it'll be a very long-lasting result. We can never, unfortunately, guarantee that, and some people may experience sort of a relapse of their trigger finger phenomenon, even despite a steroid injection. However, it's minimally invasive, obviously, and it's a very low-risk thing to do, and if it's helpful, that's a success. For people who have either tried a steroid injection with no benefit, or for people who I don't think would be a good candidate for a steroid injection, we can do what's called the trigger finger release surgery. That's done here in the office, just with local anesthesia. You can drive yourself here to the office and drive yourself home. The procedure takes about 5 to 10 minutes in total. It's really not too arduous. What we do in that procedure is to make an incision directly over top of that A1 pulley through the skin. The incision is only about 3/4 of an inch long. Then we go down to where that A1 pulley is that we've been discussing, and we physically open that up. When we do so, we actually have you make a fist while you're there with us, having the procedure done, and we can right then and there kind of establish that you don't have any more of that catching or locking in your finger. And that's a nice way for us to know that we've done the job in an adequate way. We put a couple stitches in the skin where we've made the incision. A soft dressing goes over your hand. You wear it for about 5 days, come back and get stitches out, maybe another 5 to 10 days after that. Restrictions aren't too arduous for most people. I would say most of our patients are back doing everything they need to do with their hands in about 3 weeks' time. Some potential risks with a surgery like this are really very few. Stiffness is probably the number one risk after a trigger finger release surgery. And I would say that a lot of folks that come to us with trigger finger problem already have got some pre-existing stiffness, and that's something that in a minority of patients may even take some occupational or physical therapy to work that out. All in all, it's a very good procedure. If you suspect that you might have this problem, I would urge you to seek out a referral from your primary care doctor or make a phone call to us. Hopefully we can help.